All right. Good evening, everybody. Tonight is night 15 of our 24 nights of live streams, breaking down all parts of the 2024 legislative package, the Trump-Biden peace plan. It is not too late to de-escalate this election. It's not too late to move our country in a better direction. It's not too late to end poverty, end mass incarceration, and end the endless wars. And we can do this. We can do this by reminding ourselves, reminding each other reminding ourselves about what this country is based on, what our goals are as a nation. We can do that by getting back to the preamble for the United States. And so we always start these sessions off by reciting the preamble. There we go. We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, do ordain and establish this Constitution for the United States of America. We can do that. We can do these things by coming together as a union of swing voters, refusing to play this partisan politics, this lesser of two evils game that persuades Americans to fight against each other, and instead of fighting, come together and work together to build a better America. That's the goal. And the way that it works is pretty simple. As a union of swing voters, trying to collectively bargain for a better social contract, you have to say what that contract is, what you want. And so the Trump-Biden peace plan lays out 101 policies that will upgrade America's social contract. And so for the last 2 weeks, we've been working our way through it. And tonight we are going to continue with Title IV. We're going to continue with looking at the healthcare reform provisions that are in this. Last night we talked about a public option for healthcare, for health insurance. But there are other issues with also talked about restricting the use of spread pricing by pharmaceutical benefit managers that contribute to the high costs of drug prices. So we talked about some of the ways of improving access to health insurance, addressing drug costs, and tonight we're going to talk about increasing the supply of doctors and paid family leave. Paid family leave is really a no-brainer. Which you should, if you look around the globe, you can tell, because everybody else does this except for us. We don't have to be backward anymore. We can turn ourselves around and move the United States forward. All right. Let's go ahead and jump into the legislative package. Okay. Distribution of additional residency positions. All right. So, according to a study published earlier this year by the Association of American Medical Colleges, the U.S. will be short as many as 86,000 doctors by 2036. Now, I've also seen another citation for saying that the United States will actually have a shortage of up to 124,000 physicians by that time. In any case, it's an awful lot of doctors. Our population is aging, doctors are retiring, and medical school is expensive. It is a long process to become a doctor. And so Sometimes when people want to become doctors, they cannot find a place to do their residency as part of the on-the-job training that is part of the process of becoming a medical doctor. And so Section 416 is going to increase the number of residency positions. A few years back, Congress recognized this problems. Again, could be short 100, 15, a decade from now, could be short up to 100,000 doctors. So they recognized this problem and said, we've got to do something. And so you can see here what they passed, which will increase the aggregate number of such positions to 1,000, not more than 200 for each fiscal year. And so what Section 416 of the legislation does is increase that number to 18,000, 3,600 per year. And it's basically just reference updates for that. I think it's worth pointing out too that whether it's 1,000 slots or 18,000 slots, it doesn't actually translate into that many new doctors, because training takes 3 to 5 years to complete, and you need 1 slot for each year. So this is not intended to fix all of the problems. It's intended to be a step in the right direction. Especially international students frequently can't find a slot available, and so they take the medical training that they've received here back to their home country, which presumably can also use that knowledge and experience. But there's doctors being left on the table, so to speak. We have an opportunity to increase the number of slots available and increase the number of doctors. All right, Section 417. So becoming a doctor is generally a long process. Currently, you take 4 years to get a bachelor's degree, and then you spend 4 years in medical school. So 8 years of training to become a doctor. And higher education is expensive. So there are financial burdens in the way of many people who would like to become doctors, but are unable to because of those financial constraints, right? If you ask a first grade classroom, what people want to be what the kids want to be when they grow up, right? And I'll bet you there's a pretty healthy percentage of those who say doctors. This is part of our human nature, to want to help each other, to want to improve the quality of life for other people. And it is a basic human instinct to take care of each other. And the financial constraints frequently block people from exploring those paths. So the next 2 sections really do 2 things. The first is promoting 6-year direct entry medical programs. So rather than 4 years of a bachelor's degree and then 4 years in medical school, combine them into one program that you can accomplish in 6 years. And there are actually a number of schools that are already offering these. They're already offering these programs because, again, the bachelor's degree is a little more, I want to say broad, right? And then you go into do the medical school. So but by focusing on one goal of becoming a doctor after 6 years, you can get things done. So you can save people 2 years of higher education. So you can reduce the costs that are associated with training new doctors. You can get new doctors into circulation quicker. And again, a number of schools are already offering this. So what this section does is it encourages that with over a 5-year period, $150 million in grants for schools to offer these programs. And yeah, I should say too, other countries have, do something similar. It is the United States has one of the longest training programs for doctors. And, you can see the results of that in the upcoming doctor shortage that we're looking at. So over 5 years, encouraging this program. Let's go ahead and take a look at this text. All right, so what we do in 417, we add a new subpart promoting 6-year direct entry medical programs for expansion of existing ones or establishment of new ones. And Secretary of Health and Human Services makes that to help cover direct expenses and indirect expenses for these programs. The payments are not, I told you it was $150 million over 5 years, and that funding is the greatest in the first 2 years, fiscal years 2026 and 2027, drops by 10 million the following fiscal year, and then 20 million for 29 and 30. So, and administrative expenses are capped at 5% annual reporting, and ability to audit, reduction if schools don't do the reporting, then their payments can be reduced. Regulations and some basic definitions. All right, section 418. This would allow Stafford loans for students enrolled in an approved 6-year direct entry medical program as defined in the previous section. So that's all that section 418 does. All right. Stafford loans are direct loans, and they are sorry, I lost my train of thought. College loans are not my area of expertise. Yeah, so these sorts of the Stafford loans are generally only available to people, for their first 4 years of college. They are only available, and then for graduate students, you've got to go into a different category of loan that is less. Less beneficial, but it's not as good of a deal for a federal student loan. The Stafford loans are the better deal. And so what section 418 would do would create, as you just read, create an exception for those enrolled in the 6-year medical program. So so that we're addressing a number of these issues here. The financial costs by cutting the number of years needed to become a new doctor, making better loans accessible to people who go through this program, and then after they've gone through the program and they're needing residency slots, making more residency slots available. So there's those three things. Section 419 is a different one. This is the Conrad 30 waiver program, and this is a program that's been around for coincidentally 30 years. And what had happened is back in the 1970s, Congress was concerned about there was going to be a doctor surplus. And so international medical graduates, people who came from another country to go to medical school here, Congress passed a law that says, okay, once you've graduated, you got to go. You can't stay here. You got to go back to your home country for at least 2 years. Okay, so that So we started making sure that every international doctor was kicked out. But in 1994, Senator Conrad, he helped create a new, using bipartisan legislation, new program. There was the Conrad 20 program. And essentially what it does is, instead of automatically kicking international doctor out after they've just finished their training here, getting a medical education here in the United States, instead of kicking them out, we allow currently up to 30 of these graduates to stay in the United States per state. So each state gets 30 waivers. And yeah, so 30 waivers per state. However, here's the thing about states. Maybe you probably already know this. Not all states are the same size. Not all states have the same needs. Not all the same states have the same demand for doctors, depending very much on their population, right? You've got California with close to 40 million people, thereabouts, and you got Wyoming with like 600,000. So what Section 419 does is, and so what happens, right, is if Wyoming says, well, we don't need 30 more international doctors here, and there are a number of states that don't actually use all of their waivers, then what this would do would allow the reallocation of those unused waivers. So still the same 1,500 waivers per year, 30 times 50 states, still the same 1,500 per year, but if some states don't use them, then let other states who have maxed out, let them use those unused waivers. And in addition, this isn't a blank check. This is in fact those unused waivers will need to be used to serve rural areas, places where the need for doctors is higher. All right, so here's what we're going to do. Beginning September 30th, 2025, every year after, each state agency that received a waiver will report how many they didn't use, and they will be reallocated. The Secretary of State will lay these out. 50 of the supplemental waivers, 50% must be used to support physicians in one or more facilities that serve patients who reside in a medically underserved community, as defined. So yeah, that's pretty much it. Instead of kicking out doctors, international doctors who've just graduated from school here in the United States, instead of kicking them back to their own country, if they want to stay and work in a rural, underserved area, make a waiver for them more accessible. That's it. All right. That is those four sections of the bill is how we can increase the supply of doctors here in the United States. All right, so now we're going to move on to the next part of the bill, which is paid family leave. Paid family leave is good policy. For one, the United States is long overdue. Virtually every other country on the planet requires paid maternity leave. Most industrialized nations offer paid family leave. And this is another benefit of your American Union job, that if you have paid employment, you will be entitled to paid family leave as well. Just to clarify, if it needs clarification, your American Union job, your unconditional basic income is unconditional. So you're not losing that income when you take family leave. The paid part is from essentially an insurance program that you'll pay into as an employee with your employer, as we'll see in just a minute. So some states have already implemented these things. California, for example, Time Magazine reported in May of 2019, they found, quote, using data from nearly all employers that existed in California between 2000 and 2014, researchers from the California Economic Development Department found that the average firm had lower per worker wage costs and lower turnover rates than it did before a paid parental leave law took effect. Think about that. Paid family leave reduced their costs. Like, this is good policy. This is why the rest of the world has been adopting it. And the United States is just backward. So we're going to fix it. We're going to turn it around and make sure that everyone has access to paid family leave in the United States. These provisions that we're going to look at here in a second, they mostly come from Senate Bill 248, the Family Act, which was introduced by Senator Gillibrand in New York. It's the Family and Medical Insurance Leave Act, or the Family Act. I don't know where the Y comes from in family, but otherwise it's a good acronym. So, we talked about last week, was it this week? I don't remember. We talked about the infant mortality rate in the United States and how our infant mortality rate is higher than pretty much any other industrialized country. It's 40% higher than the European Union average. And so this is one of the policies that is proven to reduce the infant mortality rate. That if we can bring our infant mortality rate just down to the average of the European Union, which the European Union is pretty broad, there's a lot of disparity between the best performing and the worst performing countries in the European Union. But if we could just bring it down to their average, cut our infant mortality rate, you'd save the lives of about 8,000 babies a year. Not fetuses, but newborn babies that are going to needlessly die before their first birthday, in many cases because their mothers have to go back to work. We can fix this problem. We can save their lives. This is part of promoting the general welfare, the health, happiness, prosperity for each and every one of us. Last, like the public option for health insurance, as I said, some states are already offering this benefit, the paid family leave, but I wish I had the statistic in front of me. The vast majority of employers do not offer it, but in many cases when they do, it's tied to your employment there. And as we talked about with health insurance benefits, if you want to leave your job, find another job, many people, 1 in 6 are concerned that they're going to lose access to their health insurance, and so they stay in a job that they would prefer to leave. That same sort of restriction applies on paid family leave when it's your employer, when you get it through your employer. And so we're going to address that problem also, because this will be a national program. So you can work for years and years at one company, and then if you go to another one and your family is expecting a child, has a new child, then you're automatically covered. You don't have to be trapped in a job to try and hold on to those benefits that you've already earned. As a national program, you'll be earning those benefits all along. All right, section 421 is the findings and purpose, and some of this I've already covered, but here we go. The Congress finds the following. 1. The United States is one of only a handful of nations that does not protect new mothers by providing paid maternal leave, which is a demonstrated way to reduce the infant mortality rate. Our rate in 2021 was 5.4 deaths per 1,000 live births, or more than 60% higher than the European Union average. If America's infant mortality rate could be brought down to the average of the European Union, the lives of an estimated 7,700 newborns would be saved annually, or 21 babies every day of every week of every month of every year. 3. Paid family leave will better enable both men and women to take care of family members in need, strengthening families and reducing the public costs of care. It is the purpose of this subtitle to improve the health, happiness, and prosperity of working people by empowering them to take time away from employment to provide care for a family member. Yeah, that's pretty straightforward. I think I said 40% higher than the European Union average, but apparently it was actually 60% higher, or is 60% higher. In any case, we can do better. We have opportunities to improve, and this is one of them. All right, let me share my screen, and we're going to go on to section 422, which is the definitions. Come on. Okay, definitions. Caregiving day means a calendar day that you're engaged in caregiving. Commissioner, deputy commissioner. These are pretty basic things. I'll just cover a couple of them. The initial waiting period. This is initial waiting period is 5 days or the end of the month where you started. So you can kind of think of this as your deductible, right? Again, paid family leave is like an insurance program, and so your deductible is, you put in up to 5 days at your own cost, and then the next 90 days, five per week. That's not 90 calendar days. So this will cover 4.5 months. The next 90 working days are covered. Qualified caregiving. This is the stuff that's already covered under the Family Medical Leave Act of 1993. And let's see if I can drop this tab in here. All right, who's entitled to leave? So these are all the qualifying events, right? Birth of a child, the placement of a child in your family because for adoption or foster care, in order to care for a family member who has a serious health condition. Because of that, a serious health condition makes the employment unable to perform the functions of the position. Because of a qualified exigency, arising out of the fact that a family member is on covered duty or been notified of call to duty to the armed forces, and because of a qualified need related to a public health emergency. I wonder if that was added in as part of the pandemic. So anyways, so those are the basic things. Taking care of your family is the reason that for qualified caregiving. Rest of these pretty self-explanatory. That 90-day limitation period. Again, that's up to 20 days per month. So 90 days is 20 days per month is 4 months, and then 10 more days is 2 more weeks. So 4.5 months. So 4.5 months, 18 weeks. Actually, probably a little more than 18 weeks because months aren't exactly 4 months. But anyways, months aren't exactly 4 weeks. All right, so those are the definitions. Again, pretty basic stuff. We'll move right into section 423, the Office of Paid Family and Medical Leave. So we're going to establish a new office within the Social Security Administration with a deputy commissioner in charge. Subsection B, we're going to lay out their responsibilities: hiring, making regulations, entering into agreements, determining eligibility, determining benefit amounts, maintaining a system of records, preventing fraud and abuse, sharing information, making employers, or making sure they have a notice to inform their employees, and an annual public report. Number 11, tailoring culturally and linguistically competent education and outreach toward increasing utilization rates of benefits under this subtitle. I'm not 100% sure. I don't know how to translate that. All right, section 424. This is the family medical leave payments. And in subsection A, who is eligible? All right. So anyone who is insured for disability insurance benefits under the Social Security Act at the time that they're filed, which is pretty much every working individual, has earned income from employment during the 12 months prior to the month in which the application is filed. Right. So if you're not being paid for employment, then you can't get paid time off from employment. Seems reasonable, right? Filed an application, was engaged in qualified caregiving, or anticipates being so engaged. So again, if you're expecting a newborn baby, you don't have to wait until after the baby arrives to file the paperwork. You can file it ahead of time so that you can start your paid family leave, a couple weeks or whatever before the due date. All right, subsection B is the benefit amount. The monthly benefit is 2/3 of whatever your highest annual income was during the 3 most recent calendar years. So, 2/3. 2/3 of whatever per month of whatever your highest income was. That's the 1/18th, right? And so it's either that or the maximum benefit amount determined under paragraph 2, or the minimum. Multiplied by, determined by, all right, so then we got the maximum and minimum benefits amount. So the cap is at $3,600 a year. Is your cap for paid family leave? Let's play that out real quick. So $31,200 a year you can get in paid family leave, with a minimum of $600 a month. So if you worked even if you only work part-time or something like that, you could still take, you'd get a minimum of $600. And so it's 2/3 of, that's 2/3 of 900. So even if you're only making, that your employment is only $250 a week, or is $200 a week, you'd still be able to get $600 as a minimum monthly benefit amount. Benefits are reduced if you're getting disability, workers' comp, or unemployment. You can't, no double dipping, right? It's got to be a replacement for employment, and it would not affect your Social Security benefits either. All right, so subsection, these are the things: reduction of benefit if for disability or workers' comp or unemployment, if you're getting those benefits. Benefit period is it's a 12-month period, so you can't if you've got the newborn baby in January and then you adopt a child in August, you can't get two 90-day periods. It's 90 days per year, per 365 days. Subsection D covers the application. Nothing too crazy. Just tell us the conditions when it starts, and attest that your employer has been provided with written notice of your intention to take family medical leave. Subsection E is disqualification. You will not be eligible if you are entitled to disability insurance. And if you're on permanent disability, then you can't get paid family leave. Again, you can't be on leave from your paid employment if you no longer have paid employment. If you're getting, or if you're getting any other, you're getting similar benefits, or if you have been convicted of making fraudulent statements to secure benefits under this section, you'll be ineligible for a year. So if you lie and cheat, then it makes you disqualifies you for a year. All right, F is the appeals process. All right, maybe you feel you've been wrongly disqualified again. This provides for, you can request a initial adverse determination, request a review of the initial adverse determination within 20 days, and except that can be extended for good cause, and the commissioner shall provide, shall make a review. So there's burden of proof and the review process. All right. Subsection G this is about state laws. Does not preempt or supersede any provision of state or local law that authorize these things. And greater benefits are allowed, right? Nothing in the subtitle should be construed to diminish the obligation of an employer to comply with any contract, et cetera, that is greater than the benefits established in the subtitle. So it sets a floor. It says everyone gets at least this much. You can have a contract with your employer that provides a greater amount. This does not interfere with that. This only sets a floor. H is prohibited acts. This prohibits employers from firing or discriminating against someone, and creates it'd be unlawful for any person to discharge or discriminate against an individual because they have applied for paid family leave. And if you do, then you as the individual, if they do, the individual can bring a private right of action for damages and fees and costs and reasonable attorney's fee, and other costs of the action paid for by the defendant. So damages and costs. Now, this doesn't put the whole burden on the employer. The commissioner, the deputy commissioner, can also bring an action to address firing or other discrimination by employers. And if they recover any sum, it would be paid directly to the individuals affected. And if they don't, then those sums then end up in the trust fund. We'll talk about it in a second. You got 3 years from the last alleged violation to do that, and commissioner can bring injunctions. All right. I, special rule for railroad employees. Railroad employees have sort of this parallel system along with the Social Security Act that maybe made sense back in the 1930s, but really should be ironed out. In any case, it still exists, and so we have a special rule in I to cover them. J, determination. This is So this is, we looked a minute ago about the definitions, and those definitions in the 1993 Family Medical Leave Act use the term spouse. And so this clarifies that that term spouse includes an individual's domestic partner, and that the term son or daughter also includes a son or daughter of the individual's domestic partner. All right, what is a domestic partner? Well, here's your definition. Domestic partner means another individual with whom the individual is in a committed relationship. It means a committed relationship is between two individuals at least 18 years of age, in which the individual is the other individual's sole domestic partner, and both individuals share responsibility for a significant measure of each other's common welfare. That includes any relationship between two individuals of the same sex that is granted legal recognition. So it includes basically if you two people say they're a family, they're basically a family when they meet this definition of sharing responsibility for a significant measure of each other's common welfare. All right, K just says that the same payment rules that apply to Social Security also apply here. And L, this is the effective date, January 1st, 2026 is when this will go into effect. All right. Anything else in my notes? Yeah, we talked about those. All right. Section 425. All right, we're going to create a trust fund. Create on the books of the Treasury of the United States a trust fund known as the Federal Family and Medical Leave Insurance Trust Fund. And that is how this program will be paid. There are some, it's going to be funded by the taxes that we're going to talk about in a minute. And it will be funded for startup costs. It can be funded by whatever it needs until September 30th, 2026. All right, those startup costs, any amounts appropriated pursuant to subparagraph 1A, shall be repaid within 10 years. So you might recognize this, the same mechanism we used for starting up the public option for health insurance, right? The United States puts up some startup funds, and then because the program is self-paying, self-sustaining, it will get paid back within in 10 years. Trust fund will be managed, benefits managed, administration, and no prohibition. Similar to how we said the public option, there was prohibits any bailouts. No funds from the Social Security Trust Fund may be used for the Family Medical and Leave Act. All right, now let's talk about the taxes. Section 426, Internal Revenue Code provisions. In addition to any other taxes that are imposed on every tax, an applicable percentage, 1/4 of 1% in the case of wages received in any calendar year. 1/4 of 1%. That is on both the employer and the employee. So both sides, so a total of 1/2 of 1%. 1/4 for each. So when it comes to self-employment income, where you're the employer and employee, it's 1/2 of 1% contribution to this trust fund. Reference updates, and remember I said the Railroad Act has sort of a parallel structure, so we got separate references for them, that 1/4 1%. And yeah, same. Okay, so update those references, and then another reference update, inserting this new section after every place that the other ones appear. Railroad Retirement Act, again, updating a reference. And the effective date. So the tax will go into effect on January 1, 2026. So the taxes don't start until people can also collect benefits. And then 427 is the regulatory authority. So the commissioner can prescribe regulations to carry out this subtitle. So let's talk about how that would work. All right, 1/4% payroll tax. So let's say you make $50,000 a year. You would see your paycheck shrink by $2.50 a week. And that money would go into the trust fund until you needed to make a claim. And so when you birth of a child, whatever, you could then collect 2/3 of your salary, so a little under $2,800 a month for 4.5 months, or a total of $12,500. So you pay in $250 a week, and then you can collect a benefit of up to $12,500. That's how the program works. Yeah. So again, this is good policy. It's why states, it's really good policy. It's us looking out for each other. But when it's an optional policy, employers have a opportunity to shift the costs of not having paid family leave, those external costs, onto others, right? If you don't pay for your employee to have time off when she's a new mother and her baby dies, that doesn't affect your bottom line. You didn't lose out anything personally. Your profits are not hurt in the least. Whereas if you paid her to have time off and the baby lived, well, then you would have been paying out extra money. And so, despite the evidence that California has shown that establishing paid family leaves is actually in the best financial interests of employers, the vast majority do not offer it. And I should have had this percentage ready to go, but I didn't. All right, so according to a recent fact sheet from the U.S. Department of Labor, as of March 2023, only 27% of private sector workers had access to paid family leave, and only 43% had access to short-term disability insurance. And among the lowest wage workers, who are predominantly women and workers of color, 95% have no access to paid family leave. As we may or may not have talked about, the American Union avoids identity politics, right? All of these policies here are universal, that we the people forming a more perfect union, we're lifting everybody up. But the thing is that if you're one of those 95% of the lowest wage workers who have no access to paid family leave, you are going to disproportionately benefit from this provision. If you're a wealthy lawyer who already has this provision, then maybe it doesn't help you. But remember, we're only establishing a floor. Maybe your employer wants to offer something more generous. That's fine. but this is one of the many provisions that will disproportionately benefit the marginalized, the people who have not had sufficient bargaining power to improve their general welfare. And so this is how we do it. This is how we, the people, can promote and improve the general welfare of all of us. And the answer, including ending poverty, ending mass incarceration, and ending the endless wars, the answer is to come together as a union of swing voters, to collectively bargain for one set of demands, one upgrade to our social contract across all 470 federal races, to use our leverage as swing voters, someone who will vote for both Republicans and Democrats, use our leverage as swing voters to be able to decide the balance of power in the House, the balance of power in the Senate, and the next occupant of the Oval Office. With that leverage, Congress, which Washington, D.C., which is populated by politicians who all want to keep power or gain power, they will come to the negotiating table. They will not willingly lose. They will not willingly give up power when we're offering them a better option. Not just them, we're offering the American people a better option, a way to opt out of the terrible partisan electoral cycle where everybody is burned out on all the negativity, everybody's just waiting for it to be over. But what's going to happen on November 5th? Will it be over? Will everyone live happily ever after? Will will things be decided and be like, okay, we all agree now this is what we're going to do? No, that's not going to happen. Whoever wins the presidency of the United States, the opposing party is going to organize to continue fighting. Electoral politics is an endless war. We're going to talk more about this tomorrow. Tomorrow I'm going to dedicate the hour to talking about the mechanics of elections and how a general strike in the ballot box works. So we're going to do that tomorrow, and again, explain how a union of swing voters can collectively bargain for a better social contract. So there's three things that you can do to help. First and foremost, help break the polls. Insist in every poll that you are a true swing voter, that you will vote for the Republican or Democrat who gets the American Union endorsements. Those endorsements will be made at the end of the month, depending on how the results of the October 15th general strike, how that works out, and which candidates are willing to compete for the endorsement and which ones are willing to ignore the American Union. All right, so that's one. Break the polls. Number two, become a dues-paying member of the American Union. You can AmericanUnion.com, visit the website, sign up to be a dues-paying member for 25 cents a day, $7 a month. $7 a month. Maybe you're thinking, but I can get represented for free by the Republicans and Democrats. Really? Are you satisfied with that free representation that you're getting? You can do better. We can do better. 25 cents a day, a small price to pay for being able to fix the political structure of the United States so it works and benefits all of us. Last but not least, join the general strike on October 15th. One day, non-cooperation with the economy. If you can, take the day off work, no paid employment, don't spend any money, and join the Fast for Peace on October 15th. So 24 hours without food, without recreational intoxicants, drink all the water that you want, and to do so takes an intention. Don't accidentally go 24 hours without food. That takes an intention, and it's that shared intention, the intention of working for peace, fasting for peace, a desire. We can manifest a desire to de-escalate the 2024 election. Now, as my own personal commitment to this effort, I'm now on day 15 of my own fast, and I will continue fasting through October 15th. I'm still feeling okay, keeping my electrolytes up. My weight is down from 205 at the start. I'm down to 184 pounds. So I'm down 21 pounds so far, but still at a healthy weight, and I still got more fat to burn. So I invite you, I invite others to come together to join with me on the 24th day for 24 hours to stand with the American Union and say, enough is enough. We want a better choice than partisan politics. And that's what a union of swing voters offers, to be conscientious objectors and say, we will not hate each other. We talked recently about Dr. King's Beyond Vietnam speech and his opposition to the militarism, to the endless war of Vietnam. And he said, we can put our hand on the world order and say this way of doing things is not just. And this way of doing things, this way that we do politics in the United States is not just. It purposely divides us. It purposely riles us up. It is for the vast majority of politicians who thrive on demonizing their opponents, it is a flagrant violation of our constitutional duty to ensure domestic tranquility. We can do better. But again, the American Union being built on nonviolence, one of the duties of nonviolence is to lead by example. Somebody has to stop hating first. Let it be us. We don't have to hate each other. When we know we can accomplish so much more by working together. If that's the kind of vision that you want to share in, if that's what you want to see America accomplish, then join the American Union. And please tune in tomorrow evening at 7 p.m. Eastern, and we'll talk more about the election mechanics and how the rest of the 2024 campaign will